So when it comes to cleaning your hands and washing, what are the best practices that we use before we go into surgeries to make sure we don't have infections that you can use at home? So the first one is when using hand sanitizer, and this is exactly the technique I use between every patient during the day. So let me grab that and show you. So first thing I want to do is I want to take this hand sanitizer and I want to put it in the cracks of my fingers right there, okay? Every crack just got filled with hand sanitizer, and then I rub it around. Now I go to the other side and I get it into my hands there. We just rub that around pretty briskly. The viruses are fragile. They don't like mechanical disruption. So I take my hands and I do this. And then I take it and I do this and I rub it into my hands pretty aggressively and briskly. This alcohol is melting it, and this mechanical stimulation is also breaking it up. And then I'll bring it down into my forearms here in case anything touched there. Now I take my hands and I just kind of let it air dry. And I do that until it's completely dry. And there's glycerin in this hand sanitizer, and that keeps it soft. And once the sticky sensation goes away, you know it's dry and your hands are essentially sterile. Now let's say you don't have this and you have to wash your hands at home. I would get a small brush that you can get at any hardware store, and when you brush, put some of the detergent on the brush itself. And this is what we do before surgery. We rub in the crevices of every single nail on each finger first. Then we come down and we hit the fingers, and then from there we hit the palms, and then lastly we work down to the forearm. Go to the other side, I get into the crevices of my nails. There's even a pick that can get in there if you're worried about that. Get into the fingers here, get into the palms, get down here into the forearms, do one last wash, and then rinse off and dry. You don't have to do it for 45 seconds or for 2.5 minutes, but you gotta get aggressively into those crevices, rub it hard, and get a lot of mechanical stimulation in there, and your hands will be sterile. This is what we do before surgical procedures. You can do it in your life, and in the long run, you're gonna get sick a lot less and get a lot less infections, and that's not a bad thing. Thanks.